For tonight's 5:30 town hall, I'm Dave McKinley, and for Michael Wooten, it was a week that will be remembered by anyone living in the Northeast and the Mid-Atlantic as a week full of smoke and haze and orange sun with the smell of fire in the air. That, of course, because of the wind patterns that brought the smoke from Quebec wildfires down into the United States. Things are looking up for most of the Northeast today, including us here in Western New York. Air quality has been much improved since earlier in the week when our air quality was at the very unhealthy level. But the worst of it was off to the east. Places like New York City looked like they were coated in an orange mist. So as the weather patterns change and bring things more back to normal here, NBC's George Solis begins our half hour with a look at where things stand from Philadelphia.
And as forecasted, conditions have dramatically improved here in the city of Philadelphia. Still somewhat of a haze, and there is still an air quality alert in the city, specifically for those with sensitivities to smog. Still, we are seeing people with masks here at the airport. Not as many as we saw over the last 2 days when that smoke was unhealthy and even hazardous. Still, schools here taking some precautions. Children are learning virtually today. Officials say they will continue to reassess and look at weather conditions to see if they need to extend that beyond the weekend. Some services here in the city of Philadelphia have also resumed. Officials pausing things like trash and recycling as a result of the smoke. A number of events were also canceled this weekend. Also, a number of graduations that were taking place, scheduled to take place outdoors, were moved indoors, and a number of parks and recreation centers were also adjusting times to make sure people could spend as much time indoors. Back here at the airport, well, there are a few delays and cancellations, but not as many as we saw with the ground stops over the last several days because of the thick smoke from the Canadian wildfires. We are looking at maps along the Northeast, and there are a number of delays and some cancellations, but it does seem to be lessening. And again, as we move into the weekend, we are looking at better weather, and as forecasted, conditions are supposed to improve. But again, officials are warning that this is a situation that ebbs and flows, so they're urging everyone to take precautions, stay indoors, wear face coverings if you're going to be out there for an extended period of time. But overall, the outlook is looking like things are starting to clear up. George Solis, NBC News.
As we mentioned, New York was one of the worst places for air quality connected to those Quebec fires this week. Dangerous conditions there have eased, and their AQI is actually lower than ours today. The city's Department of Health and Mental Hygiene gave an update on things there earlier today.
The skies are clearing. This is good news. The morning air quality index was in the mid-60s. That's down from 400 plus just a few days ago. It's still a little higher than normal. As I just said, it's usually below 50, between 0 and 50, and we're typically at healthy levels. We expect to get there, as Commissioner Iscol said, in the coming days. Forecasts suggest that this improved weather will continue, but the AQI could fluctuate over the weekend. We do not expect it to reach hazardous levels, though, again, qualifying that with what Commissioner Iscol said, it's hard to predict what winds will do.
And back here in Western New York, it's also out with the bad air. We're starting to see the air clear up. Today, we are still under an air quality alert, though, sitting at 71 AQI right now, which is unhealthy for people who are very sensitive to changes in the air. But it's mostly fine for healthy individuals. Advisories this week have been for people to stay inside. Tonight, we are taking a look at why experts say these levels of pollution can be compared to someone who is exposed to indoor cigarette smoke on a daily basis. We are joined now in studio by Dr. Andrew Hyland, chair of the Department of Health and Behavior at Roswell Park. Dr. Hyland, we have all been kind of getting pretty familiar with the air quality index and the colors that range from green for good to dark red for very hazardous. Your study that you've done looks at the PM level, the PM 2.5 level. Let's start with that. What that recommended level is good for clean, healthy air, and what was recorded outside this week?
Yeah, absolutely. Yeah, we can all see the haze and feel the pollution outside. I could feel it myself yesterday out doing a little bit of work around the home. PM 2.5, this is particulate matter. These are fine particles that when you breathe, they go into the lungs. There are baseline levels. There's air pollution that's out there, but generally what's deemed healthy or good would be below 15 micrograms per cubic meter, about 15. So that's what, that's typically what we're seeing. What we're seeing now outdoors, you see some of the video on the screen. Those levels are, what do we experience? 50, 100, 200. The New York City commissioner was talking about levels even higher than that. So yeah, very significant levels of outdoor air pollution is what we're experiencing.
All right, so that PM 2.5 level peaked at 84 on Tuesday. Now, how does that number compare to places where there's indoor smoking of tobacco or even marijuana? Understanding there's not many places where you could smoke indoors. We're talking about perhaps your home, maybe a casino or two or other indoor areas.
Yeah, so we're experiencing one of the worst forest fires ever in Canada, where we're downwind of that, and our PM 2.5 levels today are about 84, give or take. They've been a little higher, they've been a little bit lower. If you're inside in a room where someone's smoking, you're getting at least those levels and oftentimes much greater. So if you're in a smoky restaurant or smoky bar, levels will be in the hundreds of micrograms per cubic meter. In a home, we see an average level is comparable to what we're experiencing today in the mid 80s. And then think about that prolonged exposure day after day, week after week. This really elevates one's risk that's for exposure. And then even in outdoor settings, if there's an outdoor patio setting where there's a number of smokers, even that outdoor setting, we're still seeing excess levels comparable to what we're seeing from the air pollution today. And all this is just an opportunity to take this air pollution outside and think, hey, maybe if I could make my home smoke-free today, it would be a wonderful opportunity to do that. Or maybe today's the day that you try to quit smoking and reduce your exposure to yourself and to your loved ones.
Now, breathing in bad air regularly can lead to health issues. We all know that down the line. Experts we spoke with this week cited children, people with heart or lung conditions, and pregnant women as being more vulnerable populations if we have bad air. But the question I have for you, would there be any really long-term impact on folks, even those folks, from a few days we had of smoke-filled air this week?
Yeah, especially vulnerable populations is where you see stronger effects. Any of these fine particles, and air quality is measured with lots of different components. That air quality index is composed of a few things, including the fine particle counts. But the fine particle is among the most dangerous particles. So any extra exposure is going to be giving you greater risk. Very clear relationship there, and then those that are vulnerable, that have pre-existing conditions, are at much greater risk. And then I'll also add that small children are at greater risk because they tend to breathe more, so they're pumping more air through their lungs than what an adult will be having, so they're getting even greater exposure. And then for somebody that might be working in an area where smoking is permitted, they're usually hustling, their heart rate is up, their respiration is up. They will also get kind of extra supercharged doses of some of these fine particles through the various exposures. So basically, if you're burning something, you're creating fine particles, and it's imparting risk to those around.
Don't get too close to the campfire. Dr. Andrew Hyland has joined us as chair of the Department of Health Behavior at Roswell Park. Thank you very much for coming in today.
Thank you.